Good morning, everyone. Thank you for having me. It's a pleasure to be with you all today. I'd like to thank Dr. Amani for this opportunity and for this invitation. And I'm impressed with all the effort that the scientific committee and organization committee put in to create this assembly. And this is Ohud Alotaibi, Supervisor of Interprofessional Education Unit in the Simulation and Skills Development Center at Princess Noura bint Abdurrahman University. The topic of my talk today is Tele-inter-professional education initiation and limitation during COVID-19. First, the outlines are Tele-inter-professional education concept, initiate Tele-inter-professional education learning experiences, limitation of Tele-inter-professional education applications during COVID-19, tips for successful interprofessional education learning experience. At the end of this lecture, I'm expecting from the participants to be able to define Tele-inter-professional education as pedagogical approach, understand the importance of interprofessional education and its core competencies, identify the initiation process of Tele-inter-professional education learning experiences, identify ways to overcome challenges in Tele-inter-professional education. Firstly, from where did we get the idea of interprofessional education? We got the idea from the WHO framework for action on interprofessional education and collaborative practice. The WHO recognized this framework as innovative strategy to improve the interprofessional collaborative practice in the healthcare settings. Basically, they said we need first to assess the local health needs and develop the interprofessional educational programs in our formal education, in our undergraduate study as curriculum, courses, sessions. Then from these programs, we will have collaborative practice-ready healthcare providers. What does that mean? Or what does collaborate for practice-ready healthcare workers or practitioners? They said these practitioners know how to work in an interprofessional team and competent to do so. So now, what does interprofessional education means? Briefly, interprofessional education refers to occasion when students from two or more professions and health and social care learn together during all or part of their professional training with an object of cultivating collaborative practice for providing patient-centered care. Mainly, let students from different professions, nursing, pharmacists, physician, PT, RTs, more than two professions to learn and have their training and learning together. This is what does interprofessional education means. What does intercollaborative or interprofessional collaborative practice means? This intercollaborative practice occurs when multiple health workers from different interprofessional backgrounds provide comprehensive services by working with patients, their families, carriers, and community to deliver highest quality of care across settings. And I think you cannot see the slides. Is that right? Okay, so hear me. I think I have a great voice, so just hear me. Okay. The mode of delivery we have used when we, from our experience with interprofessional education, we use the Tele-inter-professional education. So can I? No? Okay. So what the mode of delivery we have chosen when we decide to develop interprofessional education, we chosen a Tele-IPE during the COVID-19, just to let our courses go on during the pandemic. Can I share the slides now? Okay. At least I can see my slides. Okay. So we use of electronic information and telecommunication technologies to support long-distance learning, which enables 2 or more students from different professions to engage in a simulation-based experience. So it was a simulation-based experience. We want to deliver it online on an online platform to achieve shared or linked objectives and outcomes. This was our experience with the tele-inter-professional education. So if you want to develop interprofessional education, programs, curriculum, sessions in your education, you have to be aware of IPE core competencies. And the first steps needed to implement the core competency is to ensure that faculty, educators, students, and practitioners are all aware of these competencies. These competencies are value, ethics for interprofessional practice, roles and responsibilities of other healthcare professionals, interprofessional communication, team and teamwork. I'm 100% sure that all of us were well aware of these competencies, but we don't recognize them as interprofessional education core competencies, and each one of these competencies has sub-competencies as well. So if you want to develop your interprofessional education, you need to be aware with the competency and its sub-competencies. Okay, so why the WHO recommend and encouraged us to develop interprofessional education on your programs or in your curriculum or in your education? Because evidence-based says interprofessional education and interprofessional collaborative practice can close the communication gaps, enable comprehensive patient care, minimize readmission rates, promote patient-centered care, prevent medication errors. And we know that the medication order go through more than one healthcare profession. So if nurses, physicians, pharmacists have their learning together or have their training together, that will prevent medication errors based on the evidence base. Okay. If I want to plan or initiate a tele-interprofessional education and let the students from different professions give their learning and training together, what should I keep in mind first to initiate that or develop that program? First, I need to do self-reflection, learning needs assessment, self-reflection for my status as educator or as educational institution in terms of interprofessional education. Do I'm aware of these competencies and I'm really implementing this in our education? And at the same time, I need to assess the students' needs, learning needs assessment. Some of the educators thought that I'm experienced and I know my students well and I don't need to do learning assessment. I know them better than themselves. No, I'm saying this to you. No, don't do this, please. Please always go for learning needs assessment. You need to ask your students about their learning needs. Then build foundational knowledge, get familiar with core competencies. You have to be aware with the competencies and how to implement these competencies, how to use them appropriately. Use the power of a practice experience. Now it's your turn. You are the expert, you are the healthcare provider, you have the experience, so you can match the learning needs assessment with your experience in the health setting, and you can find the perfect situations and conditions that the students need to be trained on together. Resource and technology or online connection, you need to choose the appropriate platform if you want to broadcast it online, and I'll talk about this in details later on. Systematic assessment, if you want to assess your students or participants through the Tele-IP, you have to have a well-tested and validated tools. And the most important thing is to find an IPE champion in different professions. If you have IPE champion with different professions, that will make your educational content stronger and comprehensive. Okay, what we have what we faced in our experience with Tele-IPE, the common barriers or challenges that we have faced, we decided to record 2 simulation scenarios and broadcast them online. We will do the live streaming of briefing orientation. Then we will broadcast the 2 simulation scenarios online, 2 rooms, and then switch. So at the end of the day, each group will have 2 simulation scenarios. Then we will do the debriefing, live streaming debriefing. The first challenge that we faced during that time, or during the COVID-19, the scheduling and online lectures. Too much online lectures on the students' schedule. The students are from different professions, different faculties. We couldn't get them available at the same time. We postponed that session or the training experience or learning experience 3 times. Till now, we couldn't conduct it because of the scheduling and online lecture. And that also because the lack of a perceived value of IPE. The faculty, some of the faculty not valuing interprofessional education, some of the students as well, because they are not aware of the importance of interprofessional education, how it's important to learn and get your learning and training together as different or in a multidisciplinary team. That was one of the challenges. The third one was logistical and resources issue. When we decided to record the videos, we didn't choose the appropriate platform. The videos were too big on our online platform and we couldn't upload it on this. When we changed the platform, we found some of the platforms we don't have access. Students don't have access as well. Some of them not available. Some of them need budgeting. We need to cut off some of our videos and the learning objectives will be affected. So please, if you are planning a tele-education or tele-inter-professional education, you need to match your educational material with your online platform. Okay, how to overcome these barriers? I think this is the time of having IPE curriculum with IPE simulation scenario in the undergraduates curriculum to integrate IPE curriculum in the healthcare curriculum. If it's integrated, if we have IPE curriculum integrated in undergraduate curriculum, that will facilitate our work and we will have a schedule session, available time for students to be learned and get their training together. Appropriate online platform and technology availability and access. Always match your online platform with your educational materials and have shared mental model. We need to raise the awareness of the importance of interprofessional education among the faculty members, the colleges and the students themselves. Okay, the last thing I want to share with you is some of the tips for successful interprofessional education learning experience. Step 1 is start networking. You need to have an IPE champion in different professions. That will make your educational material comprehensive and strong. Tip 2, pick a topic that different professionals engage in together in the real world and cross a curriculum topic that more than one profession can participate in. Don't try to include every profession, and this mistakes what the most of educators when they developing and designing interprofessional education fall in. Don't try to include every profession. If your education material or simulation scenario needs physician, nurses, pharmacists, keep it at it is. Don't try to add extra a profession to make the scenario or to make your educational material comprehensive or attractive. Don't make this. That will take the educational material away of the learning objectives. Consider the timing and the time needed for technology availability and access. Manage a professional identity appropriately. And this is linked with start networking. If you have a multidisciplinary team with you when you follow being interprofessional education. That will make your education material comprehensive and protecting the identities appropriately. And as a nurse, I can know where I start, where I stop, and the physician can add where his role starts, where his role stops. If I will write the whole scenario, I will be there will be a bias when you are creating the roles. I will make the nurses the most important one in the simulation scenario. So you need to manage your professional identity appropriately and define the role and responsibility equally in your education material. That was the end of the lecture. Thank you so much for your attention and listening. Thank you.